Welcome, emergency nursing students, to this explainer. We are jumping right in today because we're talking about the high-stakes, fast-paced protocols for handling bacteriological specimens. Look, when you're working on the front lines of an ED, you literally do not have time to second-guess your workflow. You need a rock-solid foundation for how you identify threats, protect yourself, and collect the vital samples that will ultimately dictate your patient's entire treatment plan. Let's get to it. Now, we aren't just pulling these rules out of thin air. This vital curriculum comes directly from the Unis Training Center's Emergency Nursing Program. So this grounds our entire workflow in formal, proven, absolutely life-saving procedures. These are the exact, rigorous precautions taught to dedicated emergency nursing pros to make sure everyone stays safe and accurate in some of the most demanding medical environments out there. But before we get into the actual mechanics of collection, let's set the stage. We need to remember the invisible enemy we're actually fighting here. The curriculum puts it bluntly. A pathogen lives and multiplies at the expense of the body and its tissues, often destroying tissue cells completely. Let that sink in for a second. We're talking about disease-causing agents ranging from submicroscopic viruses all the way up to massive tapeworms. They are aggressive, they are destructive. And when a patient walks through your ER doors, strict, uncompromising guidelines are the only shield protecting you, your colleagues, and honestly, the rest of your patients. So here is our roadmap for today's explainer. First, spotting infectious disease signs. Second, safe specimen collection protocols. And third, choosing proper specimen containers. Section 1. Spotting infectious disease signs. Assessing the incoming patient. The absolute second you lay eyes on a patient in distress, one critical question needs to flash in your mind: is this patient infectious? Answering this correctly, and I mean at lightning speed, is exactly what triggers all your protective protocols. You absolutely cannot wait around for lab confirmation to decide if you need to be careful, right? Your assessment starts the minute they arrive. So during that initial visual assessment, we're talking even before you take their vitals, you are scanning for immediate visible red flags. Keep an eye out for a rash, open sores, or any kind of skin lesions. Watch for draining wounds. That means pus, blood, or really any matter oozing from an opening. And of course, check for signs of jaundice, which you'll see as a yellowish discoloration of the skin or the sclera, the whites of the eyes. If you spot any of these, those internal alarm bells should be ringing loudly. But hey, you can't just rely on what's easily visible on the surface. You've got to actively screen for systemic internal signs as well. We're talking fever, diarrhea, vomiting, or profuse sweating. Pay really close attention to coughing or sneezing, especially if the patient mentions they're having chest pain with it. Abdominal pain is a major indicator too, and so is a headache accompanied by a stiff neck. Now, as the curriculum points out, these signs could obviously indicate a whole host of issues, many of which are completely non-infectious. But here's the deal. You cannot take that gamble. If these symptoms are present, it immediately mandates that you put your guard up and exercise protective measures, no exceptions. Moving right along to Section 2, safe specimen collection protocols, maintaining the chain of custody. Okay, the absolutely crucial point here is maintaining an unbroken chain of custody. Let's walk through the 3 strict steps for doing this right. Step 1, you have to collect the specimen before giving the patient any treatment. Think about it. If you pump them full of antibiotics before taking a culture, you've probably just ruined the result. Step 2, pack the sample in a sterile container to completely prevent any leaks or breaks. And Step 3, send it directly to the lab. Seriously, any delay can damage the specimen and lead to catastrophic false results. As an emergency nurse, your speed and care in this moment directly dictate the quality of the lab's findings. It's all on you. But it's not just about speed, right? Your collection has to be ruthlessly accurate. For example, if you're testing for TB, you need true sputum pulled from deep in the lungs. Saliva from the mouth, that's just going to trigger a false negative. The sample also has to be big enough for all the necessary tests the lab needs to run. Plus, and this is huge, the specimen is totally useless if it gets lost in the shuffle. It must be properly labeled with complete info: the patient's full name, age, clinical history, their address, and the exact type of specimen and analysis needed. You're basically painting a perfect, comprehensive picture of this patient for the folks in the laboratory. Which brings us to our final section, Section 3, choosing proper specimen containers, the final processing step. Now, this matching guide right here needs to become your ultimate mental checklist. You've got to memorize this rapid fire so you never ever drop a critical sample into the wrong container. Let's quickly trace them across. A sterile test tube with a suitable cover, that's your go-to for urine culture or CSF. A blood culture naturally needs its own dedicated blood culture bottle. Stool cultures, those go into a clean stool box or cup. If you're doing swab samples, they absolutely must go into a sterile swab inside a sterile test tube. For true sputum, you'll need a sterile bottle. And finally, if you're drawing blood for serology, like a Whittle test for instance, that just goes into a standard sterile test tube. Listen, mixing these up isn't just some minor administrative typo. It literally ruins the sample, delays the diagnosis, and puts your patient in serious danger. Which brings us to the core takeaway of this explainer. Accurate analysis begins with your collection. Always remember that the ER's entire ability to diagnose and effectively treat a patient completely depends on your precision right there on the front lines. The lab is literally only as accurate as the specimen you provide them. So I want to leave you with this question to carry into your next clinical shift. Next time you cap a sample and hand it off for transport, ask yourself, did I just hand over a compromised fluid, or did I just hand over the exact, pristine key needed to save this patient's life? Thanks for joining me on this explainer today. Stay sharp out there and keep protecting your patients.